Hello, my name is Leslie Clark, and this is my Court Advocacy Project exhibit. It's titled Beyond the Bedside, My Growth as a Healthcare Advocate. My social issue is access to healthcare in Omaha with a specific focus on school-based healthcare access at Benson High School. Through this project, I grew from recognizing barriers to care to becoming more intentional about how I research an issue, identify important stakeholders, communicate concerns, and evaluate outcomes. My first section is values and identity. These were shaped by working with patients and families during vulnerable moments and by challenges that tested my own resilience. My story of self reflects the importance I place on dignity, compassion, presence, especially in helping people feel seen rather than processed. It also shows how my understanding of advocacy began to develop. Advocacy is not always a large public action. Sometimes it begins with noticing a need and choosing not to ignore it. So here I have my audio story of self, and then also the outline for you to read. The next section is my social issue research. Initially, my research examined healthcare access very broadly. I studied barriers such as cost, transportation, insurance, provider shortages, and appointment availability. And what I learned is that having insurance or living near a hospital does not guarantee meaningful access. Patients can still experience delays because of scheduling, co-pays, clinic capacity, transportation still, or just difficulty navigating healthcare systems. My early work here also taught me that trying to address every barrier at once really weakened my message, and I needed to have a more narrow, more focused issue. I needed to focus on more narrow issues to have my voice heard better. And so here I did include my my early research paper for healthcare access. Also, a supporting artifact is this presentation on reimagining healthcare in my nursing healthcare policy course. And then, of course, my social issue brief from Core 201. The next section, systems and policy analysis. My work here helps me understand that access is influenced by funding, staffing, policy, organizational responsibility, and coordination between healthcare and community institutions. The Benson High School Clinic became a clear example of that. The clinic space, a clinic space already existed, but students cannot benefit from it while it remained inactive. And this really helped me understand the difference between a healthcare resource physically existing and that resource being meaningfully accessible. And so here I really talk about patient navigating and affordable primary care options in my white paper, and recognizing that recommendations are more meaningful when people and organizations responsible for carrying them out, they're clearly identified. So those stakeholders and people that can actually make the change are identified. And then the next section is advocacy, and this is also pertaining to the Benson High School Community Clinical Rotation. During that clinical rotation, I observed student health needs and learned that the medical and dental clinic was not active. Now, I was there as a nursing student to help assess students and screen them for hearing, vision, and dental needs. When I learned that this clinic was inactive for a little over a year due to circumstances that even the school nurse could not explain, I contacted Charles Drew Health Center and Omaha Public Schools because I identified them as the key stakeholders connected to that clinic. I needed to protect student privacy, so I did that and focused on general access concerns and made sure I was speaking on behalf of myself and not my college or anything else. Like, as a nursing student who recognized a need, recognized something that was an access issue that they could help resolve. Charles Drew, once I reached out to them, later confirmed that the clinic was now open, busy, and providing medical and dental care, which was great. And now I can't claim that my advocacy alone caused that outcome. However, this response confirmed the concern was valid and that the clinic was an important community resource, and it helped cement the fact that, like, let's narrow our focus. How can we do one thing to help impact the community a lot, instead of being like, oh, well, transportation, oh, copays, oh, this, oh, that. It's this one thing, this one access thing. How can that help? And I feel like that was a great example. My last section is growth and impact. I entered this course already willing to speak up when I see a problem, especially with healthcare access, especially with barriers to healthcare for the community. My growth was really in becoming more focused, strategic, ethical, and realistic about what advocacy is, what it means, and how I can be a change agent in advocating for people. I learned that the concern is not enough. Advocacy also requires evidence, a clear message, the right stakeholders, professional communication, and honest evaluation of the outcomes. Now, as a future nurse, I plan to continue helping patients navigate the healthcare system, connecting them with resources, and speaking up when systems create barriers to care. Thank you so much for viewing my exhibit. Feel free to reach out with any questions, comments, or concerns, or any ideas on how I can improve advocacy and creating change for my community. Thank you.